All right. Well, so it is my great pleasure to be able to introduce Dr. Peter Hotez. And I think many of you in the audience, in person and online, know about him. He's very active on social media, especially needed over the last few years with the pandemic and battling all the misinformation. But you might not know the details about Dr. Hotez. So he is the Dean of the National School of Tropical Medicine and Professor of Pediatrics and Molecular Virology and Microbiology at Baylor College of Medicine, where he is also the co-director of the Texas Children's Center for Vaccine Development and Texas Children's Hospital Endowed Chair of Tropical Pediatrics. He is also the university professor at Baylor University and fellow in disease and poverty at the James. Beyond that, Dr. Hotez has been the recipient of the Time 2024 list of influential people in health. He's also received the CEA Winslow Medal from the Yale School of Public Health. He's also received the Anthony Fauci Courage and Leadership Award from the Infectious Disease Society of America. And he also received the American Medical Association Scientific Achievement Award. And that's just the accolades he's received in the last 2 years. So we are beyond pleased that Dr. Hotez has agreed to be our keynote speaker to kick off our conference, as he's made such a sterling career as an internationally recognized physician scientist in neglected tropical diseases and vaccine development. Who better to talk to us from experience about the trials and tribulations of championing neglected and under-recognized diseases in an age where science and medicine is under threat. Without further ado, Dr. Peter Hotez.
Well, thank you very much. I hope everybody can see the slides and see me online, and it's a big honor for me to be able to speak with you. I'm sorry I can't be in Canada this week. That would have been very nice for me. Love coming to Canada, and I do have Canadian roots. My grandfather's from spent a lot of time in Montreal, and I have and his sister lived in Winnipeg for a long time, so Western Canada as well. So hopefully one day I'll get back there soon. But what I want to do today is talk about among the things that we're working on is the issue of vaccinating against chronic infections. And you might say, well, how does that differ from making vaccines against some of the more common acute infections that we hear about? And the answer is it's, one of the things that I have found, and one of the reasons I'm so sympathetic to and empathetic with people with long COVID, is advocacy for chronic infectious illness or related infectious illness is really challenging. And it's something I've struggled with my whole career, getting people to care about chronic and debilitating infectious disease related conditions. It's very hard. And I know you know this better than anyone, getting people to consistently care about and understand the profound importance of chronic infectious related conditions. And in my case, I came into it through chronic tropical infectious diseases, and I'll speak briefly about that. But then we, for the similar reasons, we began taking on making vaccines for COVID and wound up making a COVID vaccine for global health that reached 100 million people in India and Indonesia. But again, this idea of vaccinating and preventing and reducing the risk of long COVID and chronic debilitating conditions remains. And so that's kind of a pervading theme throughout my comments today. So I'll start here, just briefly telling about what I do. I'm a pediatrician vaccine scientist. I did my MD and PhD in New York City at Cornell Medical School, and together with what used to be called the Rockefeller Institute for Medical Research. Now it's called Rockefeller University. And there I began working on a human hookworm anemia vaccine, which is a chronic debilitating cause of anemia in low and middle income countries, as an MD PhD student. And now, 40 years later, that's showing high levels of protective immunity in clinical trials. In fact, it was David Demert, my colleague, who got his medical degree at the University of Alberta, who ultimately showed that our vaccine is achieving that high level of protection. So I'll briefly talk about that. And then we began working on coronavirus vaccines even before COVID for SARS and MERS. And then when COVID hit, we began turning our attention to that. And I'll talk about our low-cost COVID vaccine for the world. That whole part was planned. That's what I wanted to do with my life, become an MD, PhD scientist, making global health vaccines for the world, low-cost vaccines for the world. The unplanned part, as John Lennon says, life is what happens when you're busy making other plans, is having 4 adult kids, including Rachel, pictured at the top there on the right, who has autism and intellectual disabilities. And I wound up writing this book, Vaccines Did Not Cause Rachel's Autism, to counter what was then the major accusation against vaccines starting in the late 1990s that continues today, false claims that vaccines cause autism. And I'll talk briefly about that. But that wound up making me public enemy number 1 or 2 with anti-vaccine groups. And as scary as it was, and it's still scary, it also gave me a front row seat to understanding what this anti-vaccine movement is all about. And I could watch as it shifted or changed over time. And the new book that just came out last year, The Deadly Rise of Anti-Science, looks at this new iteration of the anti-vaccine movement that's become politically engaged. And of course, now we've got in the United States, we've got 2 presidential candidates running on anti-vaccine platforms, including Robert F. Kennedy Jr., who publicly targets me and writes false things about me in his books. He publicly labeled me the OG villain a couple of years ago, and I'm so old and square, I had to look up what that meant, and it means the original gangster villain. So thank you for inviting the original gangster villain to come and speak with you today. So I want to start out. So this is kind of a 2-part component to this, both advancing vaccine science and combating the vaccine anti-science. And now I realize that going up against the anti-vaccine activists may be almost as important in terms of saving lives as making vaccines, something I never would have imagined 40 years ago. So let me just briefly tell you about where we are with the global impact of childhood vaccinations. And this actually comes from an organization known as the Institute for Health Metrics and Evaluation, and they're based at the University of Washington in Seattle. And by the way, anybody can download this information. It's a fabulous results tool, they call it, interactive website. And it's down at the bottom there, and it's called healthdata.org. It's one word. And what you could do is you go into that, and their latest numbers are from 2021 that they just put up. And what you can do is download just about any disease condition, not only infectious diseases, but different types of cancer and autoimmune conditions and cardiovascular disease. And it's got it by country. And for the large countries, such as India or China or the United States, it's got it by region or department. You can do it, it's goes back 30 years, so you can follow trends over time. It's really a fabulous interactive data platform, and I would encourage you to go to it. And I recently just did this for under 5 childhood deaths from vaccine preventable diseases, and these are the numbers over the last 20 years. And I'll tell you in a minute why I picked the 20-year time frame between 2000 and 2021. And you can see that the success of vaccines has been extraordinary. The number of kids dying from measles in 2000 was 445,000, and now 20 years later, it's under 50,000. Still a lot of kids dying, but a 90% reduction, and similar numbers for pertussis and tetanus and diphtheria and Hib meningitis. And much of this came about because of a realignment of vaccine initiatives, and this happened through what's called the Gavi Alliance. And now we call it by the acronym Gavi, and it's the symbol for it is in the lower left there. It originally stood for the Global Alliance of Vaccines and Immunization, and the idea was it would bring together the major international organizations such as UNICEF and the World Health Organization, together with the big pharma companies, the academic partners, civil society, and it was actually launched with in 1999. This was the first big tranche of money with that the then new Bill and Melinda Gates Foundation started with $750 million. So this was the first big tranche of money that they gave to launch the Gavi Alliance. Now donor countries, including Canada, provide support for it. And the point is, it worked. I mean, this incredible gains in as a result of really stepping up our ability to vaccinate both children and adults. And the one issue with it is there were certain vaccines that were not being made through this Gavi alliance, and this was happening because the big pharma companies were willing to make vaccines that occur in low and middle income countries, so long as they could still have a market in the U.S. and Canada and Western Europe and Japan. So, while the big pharma companies will do a tiered pricing scheme and provide vaccines for things like measles and pertussis and tetanus, obviously more of their financial return is in North America and Europe. And the question is, what do you do about making vaccines, especially for chronic and debilitating conditions that only occur in low and middle income countries? And that's what we set out to do more than 25 years ago here in the Texas Medical Center. So I'm an academic. I run our School of Tropical Medicine, but we also make vaccines for these low and middle income countries through our Texas Medical Center. And if you haven't visited the Texas Medical Center in Houston, I invite you to all come and visit. It's pretty extraordinary. It's the world's largest medical center, life sciences complex. It's really a city unto itself. It's a medical city. We do everything big in Texas. It's a medical city of 60 institutions and 120,000 employees. It includes the MD Anderson Cancer Center and Texas Children's Hospital and several medical schools, including Baylor College of Medicine, and that's where I'm based. And it's an extraordinary place to do some biomedical life sciences because of the resources available. And we came there with this idea of making the vaccines that no one else will make. And this is our group of about 20 plus scientists. And now it's co-headed by myself and my science partner for the last 20 plus years, Dr. Maria Elena Bottazzi, and making vaccines for what I like to say the most important diseases you may never have heard of, like hookworm anemia and schistosomiasis and malaria and Chagas disease. And then more than a decade ago, we got approached by a group at the New York Blood Center led by Shibu Jiang and Lan Yingdu, who basically said to us, "Hey, Peter, just like nobody really cares about your parasitic disease vaccines, no one cares very much about our coronavirus vaccines for what were then the original pandemic coronaviruses, for SARS, severe acute respiratory syndrome that arose out of southern China and affected Toronto, or for Middle Eastern respiratory syndrome. Would you work with us?" And how could I turn that down? So we began working on SARS and MERS vaccines, coronavirus vaccines, so that when the COVID-19 sequence hit, and we saw that come online in January 2020, we pivoted our program to make that and wound up making this low-cost COVID vaccine, reaching 100 million people. We sometimes call our vaccines for these chronic and debilitating conditions in order to help convince the policymakers that they're important. And we've tried so many different types of ways to get people to care about chronic and debilitating infections. One of the things that seems to be catching on is this concept of the anti-poverty vaccines, because our neglected tropical diseases like hookworm and schistosomiasis are chronic and debilitating conditions, especially among the poor. They interfere with child development, worker productivity. They interfere with pregnancy outcome. And so these vaccines, in a sense, are poverty reduction tools. And that seems to have resonated. And maybe there's a message there. So I've written this book. Now it's in its third edition, called Forgotten People, Forgotten Diseases, and about the neglected tropical diseases. But I'm starting to think, maybe we need to have a chapter in this for something like long COVID, to really elevate the profile. And one of the things that we do is, yes, we do kind of the cool and innovative technologies like mRNA vaccines and particle vaccines like Novavax or the Moderna or the Pfizer vaccine, but we also do this. We try to be compatible with vaccine producers that are in low and middle income countries. And they're not very well known, but there's about 40 of them that band together and call themselves the Developing Country Vaccine Manufacturers Network. They're represented by the blue dots in South Asia, on the African continent, in Latin America. And it turns out that and they call themselves the DCVMN, the Developing Country Vaccine Manufacturers Network. And you can go to their website, dcvmn.org. And one of the most common technologies that many of them seem to have is they make their own recombinant protein hepatitis B vaccine that many of you may have gotten as kids or given to your kids. And this is done, it's through genetic engineering, it's done through recombinant technology. It's been around 3 decades, and it's done through transforming yeast, whether it's baker's yeast, Saccharomyces cerevisiae, or methanol utilizing yeast such as Pichia pastoris or Hensenula to make genetically engineered recombinant proteins. And what you do is then grow it up in a big bioreactor. When you visit one of these production facilities that's making hepatitis B vaccine, it almost looks like visiting a brewery because it's similar fermentation technology. But instead of the yeast producing alcohol, they're actually producing recombinant proteins. And it's a great vaccine for global health because there's no limit to the amount you can make. It's usually very low cost, often just $1, $2 a dose. It requires simple refrigeration, so you don't need a deep freezer chain. Parents trust it because they've trusted the hepatitis B vaccine. So it checks a lot of boxes if you want to make a global health vaccine. So our approach has been that we'll make the production cell bank for the prototype vaccine using this yeast fermentation technology, and then literally send it to the developing country vaccine manufacturer via World Courier, and then work with them on the scale up. And it's actually worked out quite well. So these are some of our signature vaccines for hookworm infection and schistosomiasis and malaria. And I'm showing you this not to do a deep dive into the parasitology or the microbiology, but I just wanted to show you, just remind you of the maps where these illnesses occur. So for instance, on the left in the purple shading is where hookworm and schistosomiasis overlap in the purple. And on the right is where hookworm and malaria overlap in the green. And my point being, that imagine just for a minute that you're the chief executive officer of a big pharma company or a biotech, and where's your financial return? Well, it's everywhere but the purple, right? So your financial return is in Canada and the US and North America and Western Europe and in Japan, whereas these diseases are occurring at just the opposite. So you, as a CEO, probably this is not the map you'd want to see in your business plan. So our approach is not only to do interesting science, but to figure out, is there a sustainable finance strategy to get vaccines for people who cannot afford to make them? And so just very briefly, our hookworm vaccine is it's for a chronic and debilitating cause of anemia. It's actually caused by a parasitic worm that lives in the intestinal tract. It's about 1 centimeter long. It's a very complicated target, and it attaches to the inside lining of the small intestine, seeks out small blood vessels there, rips into them, and sucks the blood out. And so so you're losing blood every day, and it causes anemia over time. And children and pregnant women tend to be the most vulnerable. I actually have a picture, a brief movie filmed by a gastroenterologist in India of hookworms in the endoscope, and just to give you a sense of what's going on. So here's the hookworm in the endoscope in the intestinal lining. There's some blood around the edge of the worm, and then the worm is basically ingesting all of the blood, and it's coursing through the body of the worm. The white part are actually the reproductive organs of the worm, so it kind of creates that barber pole effect, and then the blood comes out the other end. So the hookworm's actually feeding on the hemoglobin located inside the red blood cell. So it breaks apart the red blood cell, then it lives as this nutrient source on the hemoglobin. And as I say, it's a major cause of anemia in low and middle income countries. And my lifelong quest was to make a vaccine for this. And as I started as an MD PhD student in New York, this is a picture of Rockefeller University on the Upper East Side of New York, and wrote this article back in the 1980s about the potential for making a vaccine. And we went through a lot of iterations, tested a lot of different antigens, and finally this one, this is the X-ray crystal structure of the one we discovered. That was the X-ray crystal structure was solved by Toya and Sojo, and it's a specially adapted enzyme used for blood feeding, and was a fantastic. It is known as GST1. It was highly protective in laboratory animals against challenge infections, and then we took it through a series of phase 1 and phase 2 trials, which were funded by a European consortium based in Holland, with the Amsterdam Institute of Global Health and Development, and the Gates Foundation helped us a lot. And then now in a human challenge model, where we're infecting human volunteers with hookworm larvae and showing we can protect them, we recently got a really fabulous result where, uh, we actually showed a dramatic reduction in its ability to protect hookworms. So one of the surrogate measures we use for the number of hookworms is the fact that these worms are in the gut and they release hookworm eggs, which get out into the environment. So you can actually detect them in human feces. And this is the control, and then this is the recombinant protein vaccine on alum. And then with the CpG oligonucleotide, we achieved 100% protection, which was even better than we had hoped based on the laboratory animal models. And it also stopped the eosinophils from appearing, which often happens with worm infections and are correlated with antibody. So it was about as good a result as you can imagine. But now we're struggling because, okay, then who's going to scale it up and make it for the world? We had, and I'll tell you in a minute about our success for doing this with our COVID vaccines. But there, when we provided the technology, sent it via World Courier, no license, no patents, no strings attached, it worked because the Indian government, the Indonesian government said, "Look, you guys show it works, and you can show you can scale it up." And we worked with a vaccine producer in India known as Biological E, and then one in Indonesia named Bio Farma. The government said we'll guarantee the purchase of 300 million doses, in part because it was COVID. But for a hookworm anemia vaccine, we don't have that guarantee. So what's the business model here? And so this is one of the things that I've been doing, is kind to do a fair bit of shuttle diplomacy, going to India, going to the World Health Organization in Geneva, uh, going to the National Institutes of Health in Washington, D.C. I'll be at Institut Pasteur in a couple of weeks in Paris, really trying to figure that out. In the meantime, um, our probably our biggest success in terms of getting vaccines actually into arms has been with COVID. And I'm sorry I don't have the Canadian numbers, but my friend and colleague Alison Galvani at Yale School of Public Health just put out recently the impact of COVID vaccines in the United States, in terms of lives saved, and it's pretty extraordinary. She estimates that COVID vaccines, the two mRNA vaccines, and the particle vaccines averted 3.2 million deaths. So in the United States, instead of 1 million deaths, it would have been 4 million deaths, and averted 18 million hospitalizations. So this has really been a slam dunk success. Now, that's in terms of the impact on deaths and hospitalizations. But one of the messages that I've been trying to get across, and here's where I really need your advocacy, because people aren't listening, and it's just been a really tough to get this message across, that the vaccines are doing so much more than just, I mean, as important as it is to protect against obviously hospitalizations and deaths, it's doing more. So here's some not this is not our work. This is recent papers published in some of the top journals like Nature Cardiovascular Research, Nature Communications, the American Heart Association Journal. And I always remind people that when people think about, and of course I know I'm kind of preaching to the converted here, but when people talk about COVID or SARS-2, the virus, they always think of it as a respiratory virus. And I say, yes, it is a respiratory virus, but first and foremost, it's a thromboembolic virus and causing thromboembolic events. And with that, heart attacks and strokes and angiopathies in the lungs, which is partly one of the mechanisms touted for long COVID, and that's what these vaccines are also doing. So this very important paper came out over a year ago showing how SARS-2 triggers pro-atherogenic inflammatory responses in human coronary vessels. It's actually causing plaques to form, which are breaking off and causing heart attacks and causing strokes. And so, one of the best ways to protect your heart health is to keep up with your vaccinations. And now we're still in the early stages of proving that with real data, but the data is already showing the impact of vaccination on cardiovascular diseases. And I sometimes get a little frustrated with our Centers for Disease Control because they don't talk in this way. And so it seems like every time, I'm on one of the cable news channels, including going on CBC Canada, when I talked about that using vaccines to protect your heart health, 9 times out of 10, it's the first time anyone's ever heard that concept before, and they're quite surprised by it. But so I think we need to do a better job getting that out. And then, of course, I wrote this pretty early on in the pandemic. Should we or can we vaccinate against long COVID? And I think the answer is yes. I think it is having a big effect, and again, it's not complete, and the data is kind of trickling in, but the papers coming out really do indicate that vaccination is not only protecting against hospitalization, not only protecting against death, not only protecting against improving, necessary for your heart health, but vaccines are not stopping, but reducing your risk of getting long COVID if you keep up with your vaccinations. Now, the first question I'm asked is, "Hey, doc, what's the mechanism for that?" And unfortunately, the answer is I don't know. And when I talk with colleagues about it, everyone seems to have a differing opinion. I used to maintain that the reason vaccination may have an impact on long COVID is because, one, it's reducing the severity of illness, and because while long COVID could occur in anybody, even with asymptomatic infection or low-grade symptoms, the likelihood you'll get long COVID increases with severe illness, and therefore simply by reducing severe disease, that's the mechanism. But other people who I really respect a lot dispute that. They say, no, no, there's something else going on. Another mention is maybe it's reducing the likelihood of repeat infection. It's a possibility. But this is a big mystery. But the epidemiologic evidence is pretty strong for vaccines reducing, if you keep up with your vaccines, reducing the likelihood of long COVID. But understanding just like the mysteries surrounding the mechanism of long COVID, I think the mysteries surrounding how vaccines are preventing long COVID or reducing your risk is still up for grabs. And and this brings us to pediatric vaccines because there's so much negative press about vaccinating kids, and the anti-vaccine activists always point to the low death rates among kids, and I say that's true. But again, COVID does so much more than kill, as bad as that is, and that has effects of reducing long COVID not only in adults but in children as well. And again, tends to be underappreciated. We don't spend enough time explaining the risks of kids to long COVID. I was very alarmed when I saw the Great Ormond Street Hospital, which is one of the best hospitals in the world at University College London, came out with these very compelling numbers saying that long COVID may be occurring in as many as 1 in 7, 1 in 10 kids, and that's another really important reason I think it's important to vaccinate our children. And now we get to this problem, and here's where I came in, which is the problem of what do we do about the low and middle income countries and for COVID vaccinations. And so if you remember, the first mRNA COVID vaccines rolled out at the end of 20, beginning of 2021 in Canada, and they obviously had a huge public health benefit. The problem was they were not filtering to the low and middle income countries. So this is what a map looks like of what I call the unvaccinated world by the middle of 2021. Basically, the bigger the bubble, the higher percentage of people are not being vaccinated. And as you can imagine, it's the usual suspects. It's the African continent, South Asia, India, Pakistan. It's Indonesia. So why was this the case? Well, I think a lot of it was there was so much emphasis on speed and innovation and getting really interesting new technologies like mRNA and particles, vaccines, and adenovirus vectored vaccines. And and I'm an MD PhD scientist, and I certainly appreciate the role of innovation. The problem, though, when you only focus on kind of cool and cutting edge technologies, is that there's a learning curve before you go from zero to the 15 billion doses that were needed for the world. And unfortunately, what happened, I think, was a science policy failure, which was so much focus on speed and innovation that nobody had the situational awareness to say maybe we should have some alternative technologies that could be made locally by the developing country vaccine manufacturers. And so what happened was just enough mRNA vaccines doses from Pfizer and Moderna and from Novavax were made to be bought up by the usual suspects, the US and Canada and Western Europe and Japan, that nobody had the situational awareness. They were going to say, we're going to need 15 billion doses, and this left them out in the cold. And we were getting these frantic phone calls from wherever you see a big bubble. Hey, Dr. Hotez, can you help us? Because we heard you're making a low-cost recombinant protein vaccine, and we did. We persuaded Baylor College of Medicine to transfer the technology without patents, without strings attached. We did this with countries that had a proven ability to make good vaccines because we didn't want it to be made improperly. And India went the furthest. It's called Corbevax in India because it's made by one of their big vaccine producers known as Biological E, based in Hyderabad. And 75 million adolescents got our vaccine technology made at Texas Children's Hospital. And that was important because it provided proof of concept that you don't have to be a big pharma company to still do important things in the vaccine space. It's not to demonize the big pharma companies. They do what they do, and they do a lot of important work, and they do provide a lot of vaccines for global health. But my belief is that we should have alternative models and other options out there, and I think we provide a proof of concept that that's possible. So what was happening in 2020, uh, after sending our production cell bank via World Courier, we would then get up 4 or 5 o'clock in the morning because you want to reach them by close of business their time to work with them on the scale up and production and that these were tough times because at that point, I was speaking late into the night, talking on the cable news channels to Don Lemon on CNN or Lawrence O'Donnell on MSNBC, and CBC Canada was great. Gave me a lot of airtime to talk to people, but it also meant I didn't sleep for 3 years. But we were able to get the technology transferred, and then we transfer ownership. We basically say, okay, now we're not going to hang on to the intellectual property. You guys own it, and that worked out pretty well. So in India, this is published by the group of Biological E. They worked with their national regulatory authority, their FDA equivalent in India. It's called the DCGI, about how to do the clinical trials, how to do the data sharing, how to work with the World Health Organization for approval, which ultimately it got. And they showed the level of virus neutralizing antibody was right up there with particle vaccines and mRNA vaccines, better than the adenovirus or inactivated virus vaccines. Then did step down studies in kids, and then by by this time 2 years ago, 75 million kids had been immunized, and another 20 million adults, almost 100 million people. And then in Indonesia, we did something similar. What was interesting about Indonesia, we had told them that our vaccine has no animal cells or human cells or animal proteins or human proteins. It's in a sense a vegan process. And when we said that, they got very curious, and then they came into our labs, inspected our records of every source reagent we used in making the vaccine, and confirmed it. And then, because of that, Indonesia is a Muslim majority country. They worked with their clergy to get this certified as halal. This became the first halal COVID vaccine. So it's really interesting how things that you never would have thought of otherwise start to happen when you're going to this level, this scale. So where are we at now? I don't want to say we're out of COVID. We've just recently experienced yet another wave this summer. Looking at the wastewater numbers in Houston, Texas, where I am, now they're coming down sharply. I haven't seen the latest for Canada, so I'm hoping if it's the same that we get a little bit of a break this fall, although I expect it likely to come up again with this new XEC variant. But in the meantime, the World Health Organization is looking around and saying what's happened since 2021. So if you remember, I started out showing you what's happening in 2000 to 2021 with all of those unparalleled successes. Now things are starting to break down a bit, and we're starting to see big gaps in our ability to vaccinate. So we're starting to see breakthrough. This is globally seen. Measles epidemics, even polio now in Afghanistan and uh, um, uh, in Pakistan and elsewhere. And the World Health Organization is expressing an alarm at this, and they've now are creating a big catch-up campaign to kind of fix this, because I think it was a lot of the social disruption from COVID, also the diversion of resources. So they're putting together this big catch-up campaign that literally they're calling it the Big Catch-Up, and the official name is Immunization Agenda 2030. And I've just edited a series of papers on the Immunization Agenda 2030 with my colleague Marietta Vasquez at Yale. But it's not going so great, and we're starting to see reports from the World Health Organization that global immunization rates have stalled. In other words, we got the best we got was 2021, and now we're getting kind of not progressing. And if anything, we're moving backwards. So that's a picture of me in the monk painting over here, because I think it's not just the social disruptions and diversion of resources because of COVID. I think there's something else going on. And I think what that something else is, and this is how I want to finish, is to talk about, superimposed on this is a rising anti-vaccine movement, which I understand is pretty significant in certain Canadian provinces, including the province of Alberta. So what I want to do is finish up with you having a pretty frank discussion about how I think the anti-vaccine movement has morphed or changed over time. And it's not fun to talk about because it talks about something that we don't like to talk about, which is politics. As my training as a physician or scientist was always said, you're not really supposed to talk about politics, Republicans and Democrats in the United States, or liberals and conservatives, or red states and blue states, red being Republican, blue being Democrat. But, I have to be honest, I haven't found a way to talk about it other than to talk about it. Or so I talk about it or write about it or speak about it. Not that I care about your politics, that's your right as a Canadian citizen or as a US or as an American citizen. But to say, um, don't adopt this stuff because it has such a negative health impact. So with that sort of asterisk or cautionary note, let me take you through, give this very frank discussion of how I think the anti-vaccine movement has morphed over time, having had a front row seat to it for the last 25 years. So it began in the late 1990s with false claims that vaccines cause autism, and that's what I call version 1.0, and I'll talk about that first. That actually is still around with us, believe it or not. Maybe not as prominent as it used to be, but it's still very much there. And then around 10 years ago, we saw this kind of politicization of vaccines around this propaganda term called health freedom or medical freedom. And now we're seeing the globalized version of this, and I call the Empire version 3.0. So let me take you through 1.0, 2.0, and 3.0, and then I'll stop and happy to take questions as long as there's time. So let's talk about 1.0 first, with false claims that vaccines cause autism. Uh, for this, I use the metaphor of moving the goalpost using U.S. or Canadian football, meaning that um, an assertion is made, it turns out to be false from anti-vaccine groups. The scientific community puts a lot of effort into debunking it. And then the anti-vaccine groups come up with something entirely different. And you're continually repeating this. You could also use the whack-a-mole metaphor. You knock one down, but another one pops up. So it started in the late 1990s with false claims that came out in a paper that was published in a very prestigious British medical journal, The Lancet, claiming that it was the measles, mumps, rubella vaccine, which is a live virus vaccine you give to kids around a year of age, that the live virus was replicating in the gut of kids in the colon, and somehow that was causing what that time was called pervasive developmental disorder. That paper was retracted. It was shown to be false. And the scientific community got alarmed, though, and really wanted to confirm this. So large cohort studies were conducted showing that kids who got the MMR vaccine were no more likely to acquire autism than kids who didn't. And similarly, the converse, kids on the autism spectrum were no more likely to have gotten MMR than kids not on the autism spectrum. And that should have been the end of it. This came from the Wakefield group at the Royal Free Hospital in London. But then another assertion was made after that was debunked, and this came from Robert F. Kennedy Jr. This is when he came on the scene in 2005. He wrote an article in Rolling Stone magazine, of all places, claiming it was the thimerosal preservative that used to be in vaccines. And that was debunked, and that was, again, debunked through large cohort studies of kids as well as non-human primate studies. And that article was withdrawn from Rolling Stone. But then it came to spacing vaccines too close together, alum vaccines. And so what was happening is you started getting anti-vaccine groups that were monetizing the internet. They were selling phony autism cures or nutritional supplements that no one needed, or books on Amazon. So if you go to Amazon.com and type in the word vaccination under the book section, it's almost all anti-vaccine conspiracy books. And so there was money to be made, and so they weren't taking no for an answer. So then it came to the HPV vaccine for cervical cancer and other cancers. They said it was causing infertility or autoimmunity. And if that sounds familiar for COVID-19 vaccines, that's where they got it from. They copy pasted the false assertion onto COVID-19 vaccines. And now lately, if you look at social media, you'll see this term chronic illness and caused by vaccines. And it's such a nebulous term. How do you begin defeating that? Because anytime you approach a specific chronic illness, they just say, no, I meant this different chronic illness. So it gets more and more challenging to debunk. And that's how I got involved. I have, as I mentioned, Rachel's my youngest daughter. It's a picture of her. She was a little girl, and it's a picture of her now as an adult. And I wrote the book, Vaccines Did Not Cause Rachel's Autism, that does a deep dive showing the evidence that there's no link between vaccines and autism. But even that wasn't enough, because what I would get from parents was, okay, doc, I get it. Vaccines don't cause autism, but what does cause autism? And just to say don't blame the vaccines wasn't good enough. So in the book, we do a deep dive on the genetics of autism. There's been 100 autism genes that have been identified by the Broad Institute at Harvard MIT. We actually did have whole exome genomic sequencing on Rachel, and my wife Ann and I. We found Rachel's autism gene, which is similar but different to the others. A lot of them are what are called neuronal cytoskeleton genes involved in neuronal cell connections. So we're getting a more and more complete story. And now, after the book came out, there's been a fabulous paper. It came out at the end of last year by the Sergio Pasca lab. Pasca is a professor at Stanford Medical School in neuroscience, where he creates these brain assembloids or organoids, collections of neurons that resemble mini brains. And you can do this with neurons that have autism genes and so aberrant migratory patterns. So it's getting very close to a complete picture. But that didn't make the anti-vaccine movement going away. It just made them come up with something entirely different. No surprise there. And like so many movements, it started in uh, California, but amplified in Texas. So by the 2010s, so many kids were not getting their vaccines because parents were concerned about autism that you started to see these clusters of large numbers of kids who were unvaccinated. And to no surprise, you started to get breakthrough childhood infections, beginning with measles. And there was a big measles epidemic in California in 2014 and 2015. And the California legislature responded appropriately by shutting down vaccine exemptions. They said, for now, and you want to send your kids to school, your kids have to be vaccinated. And I supported that, and it stopped the measles problem. But it took a backlash in certain states, particularly my state of Texas. And here's where it became a political enterprise. So, under this banner of health freedom, medical freedom, the Republican Tea Party in Texas really fought against it, and they started creating a PAC, a political action committee, that was supporting anti-vaccine activities, supporting anti-vaccine activists to campaign for people running for state legislative offices, because most vaccine policy in the U.S. is set at the state level, and introduced anti-vaccine legislation. We had, Alex Jones, InfoWars podcaster based in Austin, really piling on. So it created this whole politically motivated ecosystem in the state of Texas. And the consequence of that was a steep rise in the number of kids not getting their vaccines in the state of Texas, probably now over 100,000, particularly in the suburbs of Austin, but also up in some of the North Texas counties. And this doesn't even count the homeschooled kids. And then we started to see it in neighboring states. So not only in Texas, but some of the lowest vaccination rates were in Oklahoma and Mississippi and Kentucky. And I'll talk more about that in a minute. But this is what went off the rails with COVID 19. And this is an article I wrote 2 years ago called The Great Texas COVID Tragedy, that looks at all the unnecessary deaths in American Texans because they refused COVID vaccines, particularly during the Delta and BA1 wave. And this is why it's important to talk about, because now the anti-vaccine movement's become a killing enterprise. So here I have year on the x-axis, 2020, 2021, 2022, and these are the daily deaths from COVID. So Texas was the worst affected state. 100,000 Texans died from COVID, which is actually double the number from Canada, which has a population about the same size as Texas, similar size economy. They had 50,000 deaths versus 100,000. And a lot of that was in Texas, the widespread vaccine refusal. So let me show you here deaths again. This is a pattern that many of you will recognize, at least in the beginning. So here's the first wave of COVID that affected Texas in the summer of 2020 with the original lineage. Here's the alpha wave. I'll talk in the winter of 2021. I'll talk about the green arrow in a minute. This is the Delta wave in the last half of 2021. This is the BA1 Omicron wave. And this green arrow represents the time in the U.S. by the spring of 2021 when any Texan who wanted to get an mRNA vaccine could. And you can see that almost as many Texans died after the green arrows before the green arrow, about half, about 40, 50,000 deaths, because they refused COVID vaccines. COVID vaccines were protecting more than 90% against death during the Delta wave and BA1 Omicron wave. So it was really horrific that we had to have so many unnecessary deaths in the state of Texas. And nationally, it's around 200,000 deaths, mostly in the states that we've been talking about. And now we know why. And here's again where we have to talk about, unfortunately, politics. So Charles Gaba, the health analyst, and this has been reproduced now by Axios, by National Public Radio, and other organizations have looked at that by political leanings. And this is that Delta wave of deaths, and almost all in red states, red being Republican, blue being Democrat. And the redder the county, as measured by percent Republican voters, the lower the immunization rate and higher the death rates, so much so that David Leonhardt of the New York Times just called it red COVID. So this began at the CPAC Conference of Conservatives in Dallas in 2021, where they said, first they're going to vaccinate you, then they're going to take away your guns and your Bibles. And as ridiculous that sounds to us, people have accepted that in our state of Texas. So what happened was, in their zeal to push back against vaccine mandates, which you could kind of understand, they unfortunately went the next step and falsely discredited the effectiveness and safety of vaccines. They brought on all these ardent anti-vaccine activists. There was an article in the Associated Press written about it called "They Clapped to Death for COVID." And then the pile-on came from far-right extremist members of the House and Senate, and then Fox News piled on. And two groups, Media Matters for America, a watchdog group, as well as a research group out of the Federal University of Science and Technology in Switzerland, documented how on Fox News during this Delta wave, the nighttime opinion anchors, Tucker Carlson, Laura Ingraham, Sean Hannity, basically filled their content with anti-vaccine content. And then you got Joe Rogan, the podcaster, started inviting all of the very aggressive anti-vaccine activists. So if you were, watching Fox News in the summer of 2021 and into the fall, or Rogan podcasts, or listening to the far-right members of Congress, you went down that rabbit hole and made a decision based on the information you were presented not to get a vaccine. And unfortunately, 200,000 times Americans paid for it with their lives. And now we're starting to see this spill over into all childhood immunizations as well, that same kind of partisan divide. So, if you compare Republicans to Democrats, do you think vaccines are more dangerous than the disease they're designed to prevent? I mean, clear partisan divide. Now, of course, I get attacked pretty heavily for this. Again, as much as I try to say, look, I don't care about your politics, that's your right, but don't adopt this stuff, I'm still treated as a political figure. And all you need to do is go to Twitter or see the stuff on the internet. It's pretty awful. When Steve Bannon publicly calls you a criminal, that's really something. And some of the emails that I get are the physical stalkings. I'll show you a couple of the emails, not that I want to shock you, but just to help you understand what this movement is all about. So this guy here puts it as subject, doctor. I use that term loosely. Hotez, you print one more paper or blog suggesting the roundup of free citizens, which of course I don't, to get an unproven, untested shot that's no more than a vaccine than an M&M is, which of course it isn't. I will suggest to all my patriot friends that you be hunted. In other words, the army of patriots coming to hunt me down. Or they love using Nazi imagery, and there's this kind of fantasy out there. I don't know if it's a QAnon fantasy or what, that says the COVID scientists will be tried at a Nuremberg-style Nazi war crime tribunal that they call Nuremberg II. So this guy writes, Peter, 75 years ago, people like you were tried, convicted, hung by the neck until dead. There's a lawyers committee right now collecting the names of people to be indicted for Nuremberg crimes. I'm turning your name over to the prosecutor's legal team. He gives me a link here. And of course, then he says, may the force be with you. So I got that going for me. Not that I deserve the comparison to Galileo, but I'll take what I can get at this point. And this is my last slide to say, now I think this is becoming a global enterprise. We're starting to see that same US-style anti-vaccine activism spill up into Canada. It's spilling into Europe with far-right parties in Germany and Austria, and now we're seeing it in low and middle-income countries. So I met with Dr. Tedros at WHO and to express my concern that this is becoming truly a global movement. So let me stop there, and I'm in your hands, happy to take questions if there's time, and let me know how I can be helpful. So thank you again.
Thank you so much, Dr. Hotez. That was a wonderful talk, and I think a lot of, being in Alberta, we're known as Texas North, and so a lot of the themes that you had discussed and, in terms of anti-science, anti-vaccine sentiments, that's certainly something that we're quite familiar with in Alberta, and I think that is one big challenge that I think a lot of members of our long COVID community sometimes experience, is really this idea of not only those not recognizing their their suffering, but also just questioning the existence of their condition itself, and and everything you talked about in
Yeah,
terms
it's
of
the same thing.
vaccine.
It's the same thing in Texas. Yeah, no, absolutely, and it's so heartbreaking to. I mean, it's double indemnity, right? I mean, not only are you suffering, but you have people saying you're full of baloney and this kind of stuff. I can't imagine anything more demoralizing.
Yeah, absolutely. Well, thank you so much again for that wonderful talk. We invite all those in attendance to feel free to move to the mics, or if you have limited mobility, please raise your hand, and one of our floaters will kindly come over with a microphone for you. Susan, do we have any online questions to Phil?
We do, thank you. So I'm wondering if we would alternate. Perhaps I'll ask one and then we could move to the floor. Thank you.
Sounds good.
So we have a number of questions from individuals curious about vaccine safety and the impact on the immune system. So I'm wondering if you could talk to us a little bit about vaccines and long COVID specifically, and the possible immune system impact. There's one question wondering whether or not it's safer to get the virus or the vaccine.
Yeah, I think there's no question. You don't want to get this virus. This virus not only is affecting your immune system, but as I would detailed, is causing thromboembolic events, is causing long COVID, and it's the vaccines that are going to, more than probably any other single intervention, reduce the likelihood that you're going to experience long COVID or thromboembolic events. And yes, there are rare side effects that we can talk about, but the overwhelming impact of this horrible, horrible virus is something that has to be reckoned with.
Thank you.
Thanks for that. Satish?
Thank you for the presentation. I think it was eye-opening. I have a question about the last part of your talk, and that is that there clearly is a strong anti-vaccine movement. And one of the things that we hear about is the vaccines offer individual protection, but certainly for measles, herd immunity is important. Assuming we don't get that, how protected or unprotected would those that are vaccinated be from either the array of childhood infections or COVID? I guess to some extent what I'm asking is, at a societal level, if we just let stupid people do stupid things, is that going to affect me or not?
Yeah. Well, just a few words about that. One is, it is frustrating when people are refusing to either get themselves vaccinated or vaccinate their kids. One of the things that I try to do in order to garner some empathy for them is, remember, they're victims too. They are victims of what's really a predatory campaign that's been designed by others for political reasons, and that sometimes helps. I think in understanding that. I mean, they are just going down that rabbit hole in this whole health disinformation rabbit hole and making really poor decisions that put their health at risk because of the inundation and what they're facing. I think I'm really worried about the schools because if we allow lapses in childhood immunizations, well, we know what happens. We're going to see measles, and measles is a bad actor, right? If you have measles as a child, you have a 20% likelihood of being hospitalized, measles pneumonia, which can lead to death, permanent neurologic injury, and it goes down the list of the other childhood immunizations. So in some cases, herd immunity is important. Like for measles, it clearly is. You need pretty high levels of protection. In others, it's not so much the herd immunity, but the individual protection afforded from the vaccines.
Thanks for that. And, certainly speaking personally, having had pandemic babies myself, I was very worried about my children who weren't of age yet to get vaccines. So the rise in anti-vaccination and those rates have really increased their risk. And of course, that extends to those of us that are adults who are immunocompromised or can't get certain vaccines like live vaccines. So that is definitely another area of concern. I understand we have another online question.
Thank you. Thank you. Can I just also make a note as a suggestion to help streamline the questions? Some people are posing questions for this session in the introductory session. So on the Whova app, make sure that you're clicking on the session that we're in to ask your questions that are relevant to those speakers. So thank you. The next question is about vaccine adverse reactions. Maybe you could talk to us a little bit about the scale and scope and importance of vaccine reactions, adverse reactions, and advice for those who have had a bad reaction living with long COVID and the next vaccine.
Yeah, well, for the childhood immunizations, one of the things that I tried to do is I did this interesting exercise with the New York Times with their graphics designer who does the Sunday edition, a guy named Bill Marsh, and it's called something like you can download it. It's your child is vaccinated, what is your risk, something like that. And it was in January or February 2020 that I wrote it in the New York Times. And the graphics are the best part because what Bill came up with is this idea that you make a box representing 10,000 people. And so we did it for different vaccines, whether it's measles or HPV vaccine or influenza vaccine. In the box of 10,000 people, we do two boxes side by side. What happens if 10,000 people get the illness? What happens if 10,000 people get the disease? Get the vaccine. So, for instance, measles, you have a box representing 10,000 people. You got this giant box inside it showing that 20% are hospitalized, another big box showing death, another big box showing encephalitis and measles pneumonia. And then you do the box with the measles vaccine, and you see this tiny, tiny, tiny little pinprick of an allergic reaction or thrombocytopenia, transient thrombocytopenia. And I think that I found was useful. And we did the same thing with flu versus flu vaccine and HPV versus vaccine versus cervical cancer. And I think that helps people kind of understand risk. So for instance, with COVID vaccines, if you get the mRNA vaccines, yes, there is, especially if you're a young adult male, there's about a 1 in 12,000 to 1 in 20,000 risk of myocarditis, which most of the times is transient. But compare that to the vast amount of thromboembolic disease that you're put at risk for from the virus itself. And that's where the anti-vaccine activists come in. They kind of cherry pick and blow up the very rare side effects, or they'll misuse the VAERS system and then, attribute everything to the vaccine. And they won't give you a frank understanding or big picture of what this virus is actually doing.
Thank you.
All right, thanks. And just for the sake of time and Dr. Hotez's time, we have time just allotted for one more question. But
by the way, you're all welcome to email me. As I like to say, the anti-vaxxers have my email, so you can have it too. It's just Hotez last name at BCM. It stands for Baylor College of Medicine.edu. Just put it in the subject line that you're part of this, because you can imagine what my inbox looks like.
Perfect. And then the other thing that we can do, knowing Dr. Hotez is so busy, is that we can collate all the questions from online and in person and then just send it to Dr. Hotez in one document, and then he can just sit there and answer all the question in one Word document. So we can definitely do that as well. All right, so for the last question.
Hi, my name's Dr. Fumio Kanola. I'm a family physician who works in Canada and a creator of LongCOVIDTheAnswers.com. Thank you, Dr. Hotez, for your talk. I had a look online briefly about your vaccine, which is for COVID, which is over 90% effectiveness, which is fantastic. How can we facilitate the low and middle income countries to have the ability to create the vaccines like yours in the countries themselves? I think you did a brilliant thing in making it patent free, but I think low and middle income countries actually need the ability to manufacture vaccines. And I wondered if you knew whether that was happening or how that's going to happen.
Yeah, it's a great question, and I'm very committed to that. So one of the things that we do in our labs is we do a lot of capacity building. So in any given day, you'll see people from all over the world in our labs. Because one of the problems is you can't walk into Merck or GlaxoSmithKline or Sanofi and say, teach me how to make a vaccine, but you can with us. So we try to do that. The problem with vaccines is it's a long-term process, and to know how to do it at scale and under what I call a quality umbrella, under quality control, quality assurance, and that's what takes the time. It's not so much just building the factory, it's training the human capital. And that's where people are reluctant to invest and don't have the patience. It's if you start learning how to make vaccines in a country that's never made vaccines before, you're probably looking at close to a decade before you're going to start making vaccines. Definitely worth doing, but unfortunately, a lot of elected leaders don't have the patience for that kind of time frame, right? They don't think in decade-long time frames. So getting people to understand why that's important for their national security, I think is a heavy lift, but something that's important to do. Now, the Gavi Alliance has created a fund. I think it's $1 billion fund, for instance, to build that capacity on the African continent. And we're committed to kind of helping to build that. I think what you see among a lot of the activist community that has good intentions is they focus a lot around the intellectual property and making intellectual property available. And yes, that has a role, but the bigger problem is that human capital training, knowing how to make this stuff under a quality umbrella. So we're trying to do it now for Botswana and elsewhere, but it's a long-term process and really requires a much higher level of investment than is currently available.